Let's get started. Welcome, everyone. Thank you so much for joining us for today's webinar. We're going to be discussing how Liberty Hospital nurtures nurse joy in order to retain nurses. My name is Iman Abu Zaid. I'm an MD by background. I'm the CEO and co-founder of Incredible Health, the fastest growing and largest career marketplace for permanent healthcare workers, including nurses. Incredible Health is the only platform that allows hospitals to hire permanent experienced nurses in 20 days or less. We flipped the script where hospitals and health systems apply to nurses, not the other way around. Joining us today is Regenia Stull. She is the CNO at Liberty Hospital. Liberty Hospital is a 203-bed hospital in Liberty, Missouri, just outside of Kansas City. Welcome, Regina. Thanks for joining us.
Thank you.
So Newsweek named Liberty Hospital as one of 2022's top 10 best ambulatory surgery centers in Missouri. The Human Rights Campaign Foundation named Liberty Hospital as one of 2022's top performers in LGBTQ plus healthcare equality, which is a very prestigious designation that they have. This hospital consistently earns A safety grades from the Leapfrog Group, most recently in spring 2023, and it's the only Northland hospital to earn the highest distinction. Liberty Hospital is consistently named one of the best places to work in the Kansas City Northland area in Missouri. As a chief nursing officer at Liberty Hospital, Regina is responsible for developing strategies for clinical quality, safety, and patient experience. We're thrilled to have you with us today, Regina. Thank you so much for joining us.
Hi, it's so great to be here. Thanks for having me.
All right, so our agenda today is just listed here. This is designed to be an interactive discussion. Please feel free to ask questions in the chat. There's going to be time dedicated at the end for us to answer questions as well. And this webinar is being recorded, so a member of the Incredible Health team will be in touch to share the recording with you afterwards too. So today we're going to be covering a few topics: what's the state of the nurse labor market, how to create a joyful work environment, how to engage your staff and practice gratitude, how to retain nurses, how Incredible Health helps hospitals and nurses, and there's going to be time for Q&A. All right, let's just start with a brief market overview about what's going on with nurses today. So our demand for healthcare as a country continues to increase, right? Our population is aging, so the demand on the healthcare system continues to increase. Since 2018, healthcare has been the biggest employment sector by number of workers in the United States. 1 in 8 Americans works in healthcare. And essentially the challenge is that even though we've increased the number of healthcare workers over time, that increase is still not meeting the demand that's increasing even faster. And so we have labor shortages in many parts of the country, including nursing, which is the #1 labor shortage in the US. So this problem is projected to get worse. We are on track to be 1 million nurses short by the end of this year. The annual acute care nurse turnover is at 22.5%. That's the national average. Labor as a percentage of revenue is 48%. So that continues to rise because labor wages are going up, as both for permanent healthcare clinicians as well as for temporary labor temporary workers. And then also the days to fill is at 95 days, which is the average time it takes to hire a permanent and specialized nurse in an acute care setting. So Incredible Health has over 800,000 nurses on the platform. So one in 4 nurses in the US uses Incredible Health to manage their careers. When they are creating their profiles, we're often asking them, like, why is it that you're considering, looking for a different job? And so these are the top reasons ranked. #1 is that they're looking for career advancement. That might mean cross-training. It might mean moving into leadership. It might mean expanding their skills in their current specialties. So something to do with skill growth and career advancement. The second most common reason that's selected is I want a flexible schedule. I want a better schedule that gives me more balance. So the days of 12-hour shifts, three days a week, full-time only, are over, and nurses are more and more looking for part-time roles for different shifts, whether it's 12-hour, 8-hour, 4-hour. They just want more flexibility. The third is something to do with geography. They want to reduce their commute time, or they're looking to relocate. And then the fourth is compensation and benefits. They're looking for improved compensation and benefits. We work with CNOs and CHROs across the country, and the entire C-suite in many, many health systems. A lot of attention is on number 4, but actually we see that health hospitals and health systems that are working to address number 1 and 2, so career advancement and flexible scheduling, are able to hire more and retain more too. Final piece of data I just want to share is just one of our recent studies of nurses. This is just from the earlier this year. What are the top concerns that nurses have in general? And you can see the percentages here. So concern about the shortages, concern about their own burnout, concern about their salary and benefits, concern about the safety of their work environment, scheduling, challenges with scheduling, and concern with limited career advancement. So this hopefully just gives a kind of a quick overview of what's going on with the state of nurses in the US today. And I will next just turn over to Regina, because she has a few slides and information to share.
Okay, well, thank you for having me today. I want to talk very briefly about how leadership in nursing specifically is so really important to the vitality of the nursing force and the continued growth of the nursing force in each individual organization. Nurses come to work each day, patient care providers come to work each day, and their goal is to provide care to those they're serving. Someone is in a hospital bed that is not able to be out living their life. How can we best serve those people? And the people at the bedside, the staff at the bedside, they pour out every moment of every day, and they're trying to meet the needs of the patients they're serving. Nursing leadership comes in, and while I'm no longer at the bedside, I have the honor and the pleasure of being able to be a nurse to the nurses as the nurses are providing care to the patients. Nurses oftentimes are they can feel as though they've been overlooked or forgotten because they're just constantly pouring out, and they really need somebody standing there with them to help pour back into them. So why is leadership so important? Because nursing is so important, because healthcare and healthcare providing is so very important, and we need the leadership to help keep people's cups filled.
Got it. Before we dive even deeper, Regina, would it be okay if you just share with us just just an overview of some of the challenges that you're facing or you're trying to tackle at Liberty Hospital when it comes to nursing?
Much like I'm sure all of you, we experience the challenges that we've been having are in recruiting. We are in an area that has some different nursing schools around us, so our pipeline might be a little richer than some others in the rural areas, but we aren't in downtown cities. In the downtown city here in Kansas City. So, and we don't do some of those high level things like transplants. So some people that come out of school want to go to that higher level of care, then we're able to offer beyond, we offer open heart, but we don't do burns or transplants, so, or children. So the place that makes their heart, that brings them their joy is where they go. So we have to really, really up our game and say, well, we may not be able to offer those things, but let us tell you what we can offer, the types of care that we do provide, and how we help provide care to you. So recruitment is always a challenge for us as well as every hospital. And then retention. Retention is a struggle, especially when COVID surges started in organizations. There was a great need among all hospitals, and agency staffing became very enticing because if people were to sign up, the experienced nurses signed on with an agency, they were able to make more money and they were able to travel. And you can't fault anybody for that. But that provided challenges for hospital bases because our experienced nurses were exiting so that they could continue earning their experience in a variety of different places without being quite so landlocked. And they were able to make additional income while doing that. COVID fatigue has definitely been a challenge. Engagement of our nursing workforce is always a challenge, I think, across the board. And we implemented some professional governance model to do that, to speak to that. Feeling ownership in practice is a challenge. Leadership fatigue has been a challenge, allowing nurses to practice at their highest level of licensure. And I don't believe we're unique in those few challenges that I've just shared.
No, you're
As I
not.
think
Yeah.
they're across the board.
Got it. And so before we go even deeper here, just overall, how are you thinking about addressing, this set of challenges that you just described?
Well, we're doing a lot of leadership development and we're doing a lot of research, looking into the research. What is a best practice? How can our leaders really meet the challenges that we're facing, and how can we make sure that we aren't so fatigued with the busyness and with change fatigue, COVID fatigue, that we're not able to continue pouring in. So we're constantly in the research, constantly seeking best practices and doing offsite training and development and team building among our leadership, just to make sure that we're all on the same page and we're filled, if you will.
Great. And then when it comes to just engaging your staff as a leader, how do you think about that topic? I mean, nurse leadership is just such an interesting topic. And you mentioned the topic of leadership fatigue. You mentioned the challenge of leadership fatigue as well. So how are you thinking about addressing that?
One thing that we've done is, as I've just mentioned, we take our leadership offsite, and I do that once a quarter. And we have an agenda. We have food. We have team building activities, and we really do some deep and hard work while we're offsite, and we're coming together as one big think tank. One of the things that we're doing for engagement of our staff is by the things that we're doing in that leadership development, we're bringing back to the staff, and we're sharing those wins. We're sharing the fact that we're seeking ways to make sure that they stay engaged, and we're asking them, what is it that would entice you to go someplace else? What is it that you would like to see here? What can we best do? And the professional governance model has really helped us with that. And I've really encouraged the leadership team to, when they feel like they're really becoming more and more fatigued, and the challenges seem more overwhelming than they typically are, I encourage them to just take some time. Go take some time off, not just a weekend where you're trying to get your errands done and get your laundry done and get your house cleaned up, all of that, but take some additional time. If you want, short spurts of time, do a Friday and a Monday along with the weekends. Do the things that you can to rejuvenate yourself. Learn what those things are to rejuvenate yourself as a leader, and make sure you're doing those things for yourself and for your family.
Great.
So it's
And
that
then,
support to the nursing leaders, I think, has throughout my career has been a missing element that is very deliberate and very purposeful.
got it. Okay. That's fantastic. So how about the topic of nurse retention? You mentioned that as a challenge at your current hospital. Just strategically, how are you thinking about addressing that and bringing that, improving retention overall?
Well, actually, our first big step that we took was implementing the professional governance model.
Yep.
While I was in nursing school, I was taught, it was ingrained in me, that you need to really own your practice, have a voice in your practice. And the professional governance model allows that to happen. And so when there is a decision that the leadership doesn't have to make immediately, we take that through our professional governance model and say, you are at the bedside. You are the experts in what you're doing. What do you feel that would work best? Would it be this, or this? Let's talk about that. And if these aren't the right solutions, then do you have a different solution that we could perhaps tap into and implement? Because I truly believe that, number one, the answers are in the room. And number two, the experts are at the bedside. And if you bring those experts to a room and then tap into that expertise in the room, you will have the right answer and the right solution. And then as we allow the nursing staff to build the culture of engagement, then that becomes its own recruitment, because that word gets out. And as nursing students come into the organization, they see that the voice of the nursing staff is really valued, and it's put into action. And that's huge for nursing and nurses.
And then on the topic of hiring, you mentioned relationships with nursing schools. Just curious just to hear a little bit more about your strategy there
The strategy, I'm sorry,
of
on
nurse hiring, tackling the
hiring.
recruitment. Yeah.
Yeah, one of the first things that we did when I first came here is we started reaching out to the different nursing schools. And we didn't have a lot of schools coming here to do their clinical rotations. There, because we had so many COVID surges and we were having to really decrease the amount of people that were coming into the organization, some of the partnerships kind of were a little strained with the nursing schools. And some said, well, we're just going to go to a different area, or we're going to try a different way of meeting the clinical needs of our students, which is where sim labs really came into play, and they were really invaluable to that. But so we made a conscious effort to go and reinvigorate those relationships with the nursing schools. And we more than tripled the amount of students that were coming into the organization to do their clinical time. To get their clinical rotations completed. While they were here, they could see that something was different here because we were really, really listening to our nursing staff, and we were really taking their voice, and we were pro nursing, if you will. I've worked in so many organizations that they were not pro nursing. Uh, they were seen as someone that just required a lot of labor expense, and that's not the way it is here. We do require a lot of labor expense. That's true, but we care for a lot of patients, and we care for them well, and we meet their needs differently. And as those students were coming in, they were able to interview us every day that they were here. And we were able to see their heart for nursing and their heart for the patients. And we were able to form really great relationships that way. And that really helped with our recruitment just right off the bat.
Okay. So I'd love to just go deeper in the topic of leadership, which is nursing leadership, which is something you're definitely an expert in with an extensive background. I think you have a few slides just prepared for us. Do you want to just help walk us through?
Yeah. So why leadership? Like I've talked briefly about, I feel so strongly that nurses are pouring out everything that they have, techs and the clinical team pouring out everything that they have, and they are providing nursing care, clinical care to those patients. But the missing element that I've seen throughout my career is who is pouring in to the clinical team, who's being a nurse to the nurses. And that's one of the things that I feel so honored to be able to do in the role that I'm currently in. I'm able to really go out and pick the brains of the nurses and say, what would make your day better? What would make you feel more complete and more fulfilled and more joy in the workplace? What would be those things? And able to really tap into them and then implement anything that's possible to implement, we're doing, because we want their voice and we're implementing what their voice is telling us. So one of the things that I also like to do when I hear those things, I jot them down. I write them down. I'm constantly taking notes and compiling them because I don't want to forget things. I don't want to miss key ingredients to what the nursing staff are telling us. I've read a lot. I've done a lot of research. And one of the best practices that I've found is that if you have a vision for a thing, write that down so that you don't forget your vision. You don't forget the true north, if you will, because if you get caught, you can get caught in all the minutia that's going on, the busyness, the constant pulls that are coming in. But if you've written down your vision and you've written down your purpose, you can continue to look at that and say, okay, how does this action, how does this activity, how does it bring us back to our vision? How does it bring us back to our mission? Some of the things that we did yesterday in our offsite nursing leadership team meeting was we put, those great big post-it notes, those great big post-it pads all around the walls, and said, if we could redevelop, recreate our nursing mission and vision and values here at this organization, what would that look like? And we just threw everything out and we redeveloped what that is based on the culture, based on the needs that the patients are coming to us having, based on the needs that our staff are having. and staying true to the nursing process and staying true to the heart of nursing. And we spent a large amount of time yesterday just really putting down thoughts, putting down different ideas that we're going to move forward with and move forward with quickly. So in healthcare, people who are doing very well clinically tend to get promoted into a leadership role. And one of the things in nursing that I think nursing across the nation and over a long period of time has not done really well historically is they take someone who's done really well clinically and they're a really great charge nurse and they say, you do such a great job. I bet you'd be a great leader. You'd be a great supervisor. You'd be a great manager. And then promote them up into that manager role and say, there you go. You are now the manager of this department. And the training stops. The resources stop because you know how to do all of those things. So do those for a large group of people. And it's a whole different skill set. So I listened to a training that Donna Wright did. She is a guru in nursing education.
Yep.
And it was many years ago, actually. She came into the room dressed like Mary Poppins, and she had an umbrella, and she came in and she was singing a spoonful of sugar. This was probably 15 years ago. And she got my attention right away. And I was like, what did I just come to? But she started sharing that when nurses at the bedside are promoted up into a leadership role, all of the time and attention and the research and the diligence that they have done to be experts at the bedside, to be, that go-to person at the bedside, they now need to put all of that time, effort, energy, due diligence into how to be a leader because the skill set is completely different. And if she said, if you wanted to remain a clinical expert at the bedside, they continue to hone those skills and develop those skills and be the best clinician at the bedside. Mixing those two things doesn't always work. You're either really good at one thing and you allow the skill set of the other to go down, or you're really good at the other and you allow that skill set to go down. And in in my career, in every nurse leader's career, there is a crossroads time that you make the decision, do I want to go into leadership and let my expertise at the bedside go down a bit, or do I want to remain that? And when you're at that crossroad, really do some soul searching. And I did that. And I wanted to answer the question. If I see the issue, I see the problem, somebody should do something about that. Who's going to do something about that? And if you're the expert at the bedside and you continually hear yourself say, somebody should do something about it, and you know what the about it is, you know what the solution is, perhaps you are feeling that pull or that call to go into leadership because you see the issue and you know the solution, and you can be the someone to do something about it. That's how I went into leadership, because I heard myself saying that somebody should do something about it. I went back to
Okay.
school, earned my master's to do it, and then
Yeah.
went back to school so I could be that person.
Yep. So leaders, of course, have to engage their staff. So sort of how do you guide your leaders or encourage your leaders to engage the staff, or what mechanisms do you have in place to make that happen?
Yeah, so a real quick gauge of that is looking at your hand hygiene compliance,
Okay.
Which is really, really a bizarre thing to say.
Yeah.
But
Yes, it
all
is.
clinicians know
Yeah.
that hand hygiene is the number one way to prevent disease spreading,
Mhm.
to prevent viral spread, number one. But it's also something that a lot of healthcare providers, clinicians are not uh, very compliant in. The more engaged a staff member is, the more compliant they'll be with hand hygiene.
Wow.
It's a
Yeah.
direct cause and effect. And I've read study after study after study that proves that out. I'm fascinated by that.
Mhm.
And I started comparing that to our hand hygiene compliance rate here
Mhm.
and our employee engagement here. And I saw a direct correlation as well.
Wow. Okay. That's definitely new information for the audience. Didn't know that.
Fascinating, isn't it?
And then as far as just what the leaders do, how are they engaging their staff?
Yeah, the number one thing they can do is round with their
Yeah.
staff.
Mhm.
we have a program here that we meet with each of the staff members. Each of the leaders meet with their staff one time a quarter, one-on-one, very purposeful, and they ask very specific questions. They make a personal connection. They ask about children, ask about their pets, their last vacation, just letting that staff member know, hey, I'm paying attention to what you're telling me. I'm remembering the things that you're telling me, and I want to make sure that those things are still happening. How are you doing? And then go into the what's working well. What are things that you'd like to see change, and really take their voice seriously. It's rounding and rounding for outcomes, and that nurse leader rounding on the staff is shown over and over and over to be a key component of ensuring that your staff remain engaged. And another way is to, as you're out and about and you're rounding with your patients or rounding with your staff, if you hear someone saying, hey, I've been thinking about going over to hospital XYZ because it's closer to my house. Their PRN rate is better. Maybe their schedule is better. And really listen in on that and say, oh, their schedule system is different or their scheduling practices are different. What are they doing? Because if we could do it better, please help us do it better. And just constantly reach out to the team to engage them in the issues. Don't hold the issues back. Don't try to pretend the issues aren't there, but continually reach out to them and say, hey, this is what we're looking at. Do you have any thoughts about that?
Yep. Great. Yeah, we've also heard tactics from other CNOs around hosting town halls and
Yeah,
having a open
yeah,
open session on, even if it's on Zoom, and just
yes.
make it a recurring
Another
or
thing,
regular.
another thing I've just recently implemented was CNO chats.
Yep.
And got a little cart, filled it up with all kinds of snacks and waters and flavorings you can put into waters, and opened it up, for it's on a specific day of the month for day shift, and then 2 weeks later, a specific time for night shift to come. And I come in during the night and open it up and say, hey, come in, tell me what you're thinking, tell me what you're feeling, what kind of challenges are you having. And recently, our professional governance team said, hey, we want to give you some feedback on the CNO chats. We love them. We love that idea. We don't like the fact that we need to come to you for that. We want you to come to us. And so I said, okay. So I stopped the CNO chats in my office or in the nursing leadership team area. And the same time that I've carved out for those CNO chats, I'm taking out the snacks and going out to the floors and saying, okay, so let's have the same type of conversation in your unit with your
Yep.
team. So that's meeting the town hall. That's doing those very personalized chats.
Got it. Okay. And then
Mhm.
yeah, what are you hearing these days? Like what's the is it a lot of
Yeah,
yeah.
the patients are sicker. The
Hmm.
patients are sicker. Our ratios they're tough because the patients are sicker. And take that forward, look at uh, the national nurse to patient ratios. Are we within that? Are we high? Are we low? And then bring back what I'm finding. And the next step that I'm doing is with one of those professional governance teams is saying, okay, hey, this is the budget that we have for each individual unit. This is the budget. How do you think we can best uh, use our ratios or best provide care within this budget? Should we have an unencumbered charge? Should we, 24/7? Should we have the lowest acuity patients, one or two of those assigned to the charge so the rest of the team can take those heavier patients? Should we have more techs, more RNs, less LPNs, more LPNs, less RNs? How do you think that we should do that? That's the next step. I'm really looking forward to that step. But bring the challenges to them and ask them, what ideas do you have?
And then what are your thoughts on just gratitude and showing gratitude to nurses?
Yeah, gratitude is one of those things that, it's like that chicken and egg thing. When you don't feel a lot of gratitude, how can you show gratitude? And if you're not feeling a lot of joy, how can you express joy or express gratitude? What comes first? Well, what I found is that gratitude, it's kind of a spontaneous feeling, and it's also a conscious effort practice, right? So I'm an extrovert For example, I'm an extrovert. I know that if I'm feeling low, if my tank is low, if you will, I can either go out and round and get with a team that brings me joy here, or I can grab a stack of note cards and start writing thank you notes. Whether I'm feeling thankful at that moment or not, doing the effort, making the effort of writing it, and putting those things that I'm grateful for down on paper, put it on a card, put it in an email, put it in a text. It reminds me of all of the things that I have to be grateful for. And as those things start coming back up to the top, my gratitude tank, if you will, it starts to come back up. I can pick up the phone and call and say, "Hey, I saw that you really jumped into an issue that was happening yesterday. I saw how you handled that. Wow, that was great. No one could have done that any better than you did. Thank you so much for doing that." So, which comes first, gratitude or joy in the workplace? Well, the answer is yes. If you're feeling gratitude, act on that. If you're not feeling gratitude, act on gratitude anyway and start refilling your tank. So what I found over my research, my study, is that people can deliberately cultivate gratitude. And it's an emotion that generates a climate of positivity that reaches inward. And the emotion is once you start doing acts of gratitude or saying thank you, reaching out to people, that inward feeling starts to come out, and people start to see that in you, and they start to feel the effects of the joy and the gratitude in you. And it's one of those emotions that is contagious. If you come in and you have a really good attitude and you're feeling gratitude to your team, that's going to spread throughout the team in the exact same way that somebody with a really bad attitude comes into the team. That negativity spreads through the team and everyone can feel it. But we have the opportunity to reverse that script and pour gratitude into that exact same workplace and start saying, "Hey, I was here yesterday and this went well and this went well. We had struggles here, but we had so many wins yesterday. Today, this issue, that's going to be a win too." And just reframe the emotion and reframe the script that's happening in the department.
Yep. So what comes first, gratitude or joy?
Yes. I'm going to say yes. The one that you
Both.
choose, the one that you choose comes first. And it's a
Awesome.
deliberate choice and a deliberate action.
And so what are the ways to practice gratitude in the workplace?
If this was in person, I would open that up to the group.
Okay.
But ways that I've seen that express gratitude are a thank you note. Goes a
Mhm.
long way. One time I had a CNO who she wasn't really good at that. She didn't say thank you a lot. She didn't do a lot. She just had a lot of expectations. And one day, I got a letter in the mail from her, and it was on this really pretty paper, like the papyrus type of paper. It was like pressed flowers in the paper. The envelope had that, the paper had that, and she had a handwritten note thanking me for all of the time that I had been putting in, all of the projects I've been working on, the successes that the organization is experiencing because of those things, and put in a gift card to a local restaurant so that we could go out. And she addressed the letter to my husband and thanked him for allowing, not allowing me, but thanked him for the support that he was giving me while I was pouring so much into the organization. That was, my Lord, it was probably 17, 18 years ago. And I still have that letter.
That's
I've
amazing.
gotten thank
Yeah.
you notes along the way. I've gotten a lot of them along the way. That one was huge to me because it was so out of character for her, and I knew it was sincere. And then she started doing that on a routine basis, and it was just so meaningful to me. It was very powerful
Yeah.
because it showed that she saw what I was doing and acknowledged that it was making a difference, and it wasn't for nothing.
Fantastic. Yeah. Michelle Burke commented, agree, gratitude is so important. They start their weekly team meetings with gratitude shout outs.
Perfect.
Um, Another practice we do at Incredible Health, we are a fully remote company. So we use Slack for communication, and we have a hashtag love channel, and where team members can share gratitude with each other, and it's quite public. It's everyone can see the gratitude being shared too.
Oh, I love that.
All right,
Another
these
thing
are.
is people putting those great big dry erase boards, the
Mhm.
really long big ones, in a public hallway, out
Yep.
by the cafeteria or even in the unit. And people can write things that they're grateful for on that. Patients do it, visitors do it, staff do it, providers do it. I've seen that. It's been amazingly effective.
All right, fantastic. And you have multiple tips here to foster gratitude.
Yeah.
Um, I love this quote. It's not, is it Regina's quote? I'm just
No,
curious.
that was from a Jesuit priest.
Okay, got it. It's not
Very
joy that makes us
inspiring.
grateful. Yeah, it's gratitude that makes us joyful. Love it.
It's a great quote. I love that too. We had a leadership training for all of our leadership from our HR department. And I was talking about that quote. And what we did is we got a bundle of 10 thank you cards, just blank thank you cards, bundled them with a ribbon. And on the corner of the ribbon, we put this quote on a little card, like the little card that goes on a ribbon that says to from, but it said, it's not joy that makes us grateful, it's gratitude that makes us joyful, and then handed those out to all of the leadership.
Love it. Amazing idea.
Yeah,
Uh, and so you mentioned gratitude actually changes your brain.
it does. I'm talking a lot. I'm so sorry, but this is such good stuff, isn't it?
Yeah, yeah.
Um, there was a study that was completed, several of them actually, and I want to pull that up, by Joshua Brown. And he pulled a group of people together and said, I want this group of people to write thank you notes and gratitude notes, but say things like, we appreciate, we value, and not really focus in on the specific things. We value the work that you do, for example. And the other group uh, wanted it to be more personal. I saw the work that you put into XYZ, and I can't thank you enough. And as a result of that work that you did, these things happened. Thank you so much. And so each group wrote, one group wrote, I thank you. The other group wrote, we thank you. And the group that wrote the first person thank yous and the very specific thank yous, their, uh, their joy and their level of gratitude increased exponentially, and much more than the ones that said we and didn't have so many positives in the thank you note. And they even put the people who were writing the I and specific gratitude notes, did a scan, an MRI scan of their brain while they were doing that, and they saw that while they were writing that thank you note, it triggered parts of their brain in that MRI. I mean, it was a fascinating study. And it proves scientifically, and you can see it, you can feel it, but it proved that gratitude and practicing gratitude not only makes your emotional state better, but it can change your brain, and it can just create these pathways in your brain that lead you to go down a road of gratitude quickly, and it becomes
Oh,
very routine for you. Fascinating study.
it is. It is. All right. So as far as what's next, we'll chat through the topics of, well, actually first let's go through you mentioned retention earlier. This
Mhm.
is like a quick hit list basically of how you're driving retention at your organization.
Yeah, this
You
is just a quick list of that. The nurse leader rounding I've talked about. A lot
Yep.
of listening, we've talked
Mhm.
about that. Follow through. If you say you're
Yep.
going to do something, follow through with that and then follow up. Hey, I said I was going to do it. I did it. This was the outcome. The loop is closed, and that's really important. Professional governance, huge, huge.
Yep.
Nurses need to have a voice in their practice, and
Mhm.
they need to be part of the solutions in an organization. And professional governance is a model that allows that. It provides a platform for that. Nurse residency. Most hospitals have a nurse residency program. I
Yep.
think what we do maybe a little bit differently is, every nurse residency day, I and our senior director of academic partnerships, we go. to the nurse residency day, and we open their day. And I let them know what's going on in the organization. Uh, and these are the big things going on, building projects, whatever's going on. And I open it up and ask them if they have heard any rumors, any gossip that's out there that they would like to know if it's true or not. I open it up and they can ask any question. And if I know the answer to it, I tell them the answer. If I know the answer and I'm not permitted to give details of that because it's not out there yet, it's not public, it's not finished yet, then I say, there's work being done around that. And as soon as I'm able to share that with you, I will. And then I do. And I open it up and I answer. And I'm very truthful. I'm very transparent. And I think transparency is incredibly important in establishing trust with the staff, with the team. So we have nursing leadership development. I've talked about the chat with the CNO and just really being sincere. People know if you're sincere or if you're trying to blow smoke. They just know. I know. Everybody knows. So don't try to fake it. Be sincere. And if you're not, maybe you might be in the wrong role.
Yeah.
Because you truly should want to know how to improve nursing care and nursing practice and the environment that they work. And then celebrate the wins, celebrate the successes.
Yeah. So one of the in our work at Incredible Health, when interacting with CNOs and CHROs, one of the most important things is to have a fantastic relationship between nursing leadership and HR leadership and those teams as well. It helps drive hiring, drives retention. I'd love to hear just a little bit just about how you think about the relationship between those two teams and how you drive success here.
Incredibly important. You cannot have those two teams working against each other or not being together. So in order to do that, what we've done is that the HR leadership team and I meet together weekly, and they bring any issues that they've been made aware of forward to get my input on those within nursing. And I do the same. Hey, we're having these issues. I really want to make sure we're on the same page and how we move forward with those. We have a really great relationship. It started out when I got here, the relationship there, from what I understood, was not as great.
Yeah.
But we've really done a lot of deliberate work to make sure that it is. So deliberate meetings are scheduled. We have recruiters that come into that meeting and share what they're experiencing, and I can answer some questions that they're hearing out in the recruitment events that they're doing. And then we look at the market data about compensation. We do that a couple times a year, actually, to make sure that we're staying within the market, and we're not only treating our team excellently, treating them well, but we're paying them according to the market.
Okay. What we'll do next is just do a quick overview of Incredible Health, and I'd just love to leave the rest of the time for questions from the audience. There's actually quite a few that have been submitted, so we'll do that in a few minutes. So Incredible Health, it is a software company. We are a software company, and hospitals use our custom matching algorithms and our technology to hire high quality permanent nurses in less than 20 days. We work with over 700 hospitals and health systems across the country, including very large ones like HCA and Tenet, large regional systems like Baylor Scott and White and Wellstar and Providence St. Joseph and Kaiser Permanente, and lots of community hospitals as well. As far as what it is that we do, there's a few unique things about Incredible Health. First, the employers apply to the nurses instead of the other way around. As you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax, and the nurse is able to choose which interviews to accept or decline. We also have proprietary screening and matching, so it's a very personalized and curated experience for both the nurses and the hospitals. And we also have robust data analytics, so leaders like Regina and her counterparts across the country can see what is happening in terms of how quickly talent is moving from one step to the next. Are there any bottlenecks? And how does the hospital compare to their local competition and their national competition, because we're often working with them as well. Finally, we also have lots of free services and tools that we offer to nurses inside our apps. Everything at Incredible Health is free for nurses. Using the hiring marketplace is free. We work extensively with nurses who are looking for their permanent roles. We offer free continuing education accredited in all 50 states. We have free nurse salary estimators. We have career coaching that they have access to. There's a community for nurses where they can ask each other for advice. And so lots of resources and tools available for nurses in our iOS and Android apps. And that's one of the many reasons we have thousands of 5-star reviews across Google, Facebook, the Apple App Store. And nurses often describe us as the best job search experience of their career, and they are thrilled by the additional free tools and services that we provide. I did just want to briefly chat about the topic of speed, because I know many people in the audience, as well as Regina, are like trying to tackle nurse hiring. What we find is that in every single market where we operate, it is actually the hospital and the health system that has the fastest hiring speed that hires the most. Usually they hire more than the hospital with the biggest brand, and they also hire more than the hospital with the most compensation. And 68% of nurses accept the very first offer they receive on our marketplace, and 61% accept the very first offer, even if the subsequent offers have higher compensation. That's happening for many reasons. Nurses are often overworked while doing their job search. Also, nurses really appreciate a rapid hiring process. It creates a wonderful candidate experience and a very strong impression of the employer too. This is just a quick case study from one of the teams we work with. We were able to reduce the days to fill from 66 days down to 19 days. What that does for the P&L, or the bottom line of the hospital, is that by hiring permanent nurses faster, the hospital is able to reduce their temporary labor costs faster and their overtime costs faster. And so this is a cost-saving product at the end of the day. We also track retention of nurses that are hired through our platform. And so the retention rate at 1 year is usually 15% higher than the hospital's baseline. The reason for that is because the nurse was able to consider multiple opportunities before selecting a specific hospital. So it's a very well thought out job search. And then also, our nurse network does skew to a little bit more experience. We do new grads as well, and have experience from, nurses from 0 years experience all the way to 30 years experience. But those that are more, tend to have more experience tend to stick around for longer. This is just one of the, this is a quick workflow of how we work together. Everyone has roughly the same 8 steps in the hiring process. Incredible Health is doing the heavy lifting in the first 4 steps. We're sourcing, pre-screening, confirming that the talent is actively looking, getting that first phone screen automatically scheduled. And then after that, the health system is taking over and completing the phone screen, getting interviews accepted, getting hiring manager interviews completed, getting offers out, and getting them accepted. So this is a true partnership. It requires both parties to drive the success. This is also a newer model in talent acquisition. It enables recruiters to operate at the top of their skill set. Regina mentioned earlier about we need nurses to operate at the top of their at the top of their license and the top of their skill set, but we also need recruiters to do that too. Nurse recruiters have an average of 10 years experience usually. They have they're trying to fill about 100 openings at any given time. That's the average nurse recruiter at a hospital. And so their time is best spent engaging with talent, speaking with nurses, and building relationships with hiring managers. We do need to help recruiters with some of this more administrative work, like sourcing and screening, that can now be handled with software like Incredible Health. All right, let's do some Q&A, and we'll spend the rest of the time on the Q&A. If there are additional questions that you think of even after the webinar has ended, or please feel free to send an email to questions@incrediblehealth.com. And also a member of our team will be in touch with the recording of the webinar too. All right, Regina, ready for some Q&A?
I think so.
All right, fantastic. So let's start with a question from Joseph Curran. You mentioned earlier about the work with nursing schools. He's curious if you have any suggestions for nursing schools of what needs to be covered in their curriculum to help students with the issues that you've raised in this presentation.
Oh, what a great question. The hospital administrator in me says, hey, let's look at critical thinking and let's get more skills at labs out there, and let's do this and this and this and this. But for the purposes of this discussion, I really think the thing that I'm seeing as uh, a challenge that I think nursing schools are having, as well as the hospitals receiving these new nurses, is interpersonal communication. Uh, there is there's so much texting and Instagram and Snapchat, Facebook, and all of those TikTok, all the social media things happening, and relationships seem to be formed virtually more now than I've seen at least ever before. I think just really having some purposeful interpersonal communication, whether it be labs or classes or speakers or projects, I think would be helpful in the orientation phase and then even in connecting the nurse to the patient and being part of the team. I've read recently that high school sports inclusion and people wanting to be involved in high school sports, that has gone down a lot. And so the team principles aren't as intuitive to people going into college now as they had been previously. So really that interpersonal skill development, I think is an incredibly important component.
Absolutely. This is just a comment from Joseph Current about the topic of, you mentioned earlier about the hand hygiene and how that's an indicator of engagement. I mean, he agrees. Honestly, if your staff are negligent regarding hand hygiene, they're likely negligent in multiple areas. And if you're not paying attention to the basics, you're not paying attention to the whole picture.
You are so right.
Yeah.
Can you imagine Florence Nightingale seeing some of the hand hygiene rates that are out there right now? My goodness.
Comment from Shauna Butler. Hey, Shauna. Regina, you are a shining outlier.
Oh, thank you.
Who do you who do you follow and learn from to improve your leadership skills and your insights? And what
Oh,
leadership programs do you recommend?
that's a tough question. The people I work with laugh at me all the time because I'm constantly talking about uh, uh, a patient experience and employee experience pioneer named Quint Studer. I'm always talking about hardwiring excellence in Quint Studer, and that really I've learned so much from the resources that he has put out there and the books that he's written. I also do a lot of reading about emotional intelligence, and Daniel Gorman is a really great author in that. I've read a lot about that, and then project management and team building. Uh, uh, Strategies. Those three things together, I think I've learned a lot from. And I focused my formal education on executive leadership and leadership development.
Yeah.
So that's where I went on and earned a doctorate degree in executive leadership. So I have a ton of leadership books. I'm always seeking those things. And Harvard Business Review is also a journal that I subscribe to. It's not a healthcare journal, but it talks about team strategies, how to run a meeting, how to do projects, how to grow your business, how to prevent things from happening. And it's taking things from the business world and it's really able to do a crosswalk and incorporate those into healthcare.
Great. A question from Neka Aziri. She said, you mentioned, Regina, you were talking earlier about increasing patient acuity, right? And how just the work environment is getting tougher. How does your facility maintain or think about adequate nurse to patient ratios?
Oh, well, we look at that's a really tough question, actually.
Yeah.
We look at the national average out there. We look at NDNQI data. We look at who's really leading with their quality outcomes. But NDNQI data, that's the national data bank for nursing quality indicators, right? And so really I follow them a lot and look at what the national average is. And for us, we try to keep it at a 1-to-5 ratio in the general med surg units. And if the acuity is really high, we do a mix of acuity and ratio. If the ratio is 1-to-5 by budget, but we have some incredibly sick patients that need to have more attention, we either need to transfer them to the higher level of care, which is our PCU or ICU, or we need to perhaps add a nurse to that mix so that we can really focus in on that patient to prevent a movement to a higher level of care. So it's a constant give and take, wax and wane. But I studied the NDNQI frequently. I'm in that a lot. And then just go beyond that to staffing and staffing scheduling solution data, and try to make sure that we're staying within that. And we compare our ratios to our quality indicators and our outcomes in quality and see if we're hitting the mark or not. And we look at processes too. So it could be that if we have a lot of new grads in an area or on a shift, and the quality outcomes aren't so great there, maybe we need to mix that up a little bit and try to get some experience there, or pull some of that inexperienced newer grad nurse back up to days, or get them into some classes so that they can hone their processes a little bit more, not necessarily jump to increasing the ratios, but let's look at our processes and make sure that those are leading to the best outcomes as possible. So it's very multifaceted.
Great. The next question was actually for me, from Tasneem. Nurses and employers aside, who are the key external stakeholders and partners for Incredible Health? And in what areas do they make an impact to your mission? Our vision is to help healthcare professionals live better lives. The mission is to help them find and do their best work. I would say outside of nurses and employers, the key parties that help us pursue our mission are, number one, the press, and number two is nursing schools. On the topic of the press, I think it's Incredible Health does get a lot of press, and we do try to drive the message of the importance of this workforce, and how we need to address the shortages overall. And I think bringing the attention, these problems that Regina has discussed, bringing it to the mainstream of the United States, where all Americans understand the challenges that are happening in healthcare, I think will help drive more and more solutions. The pandemic, of course, helped with increasing awareness of what's going on in healthcare, but we can't let up. We have to continue to share more broadly outside of our industry too, in terms of what is actually happening. And I think we have time for maybe one more question, Regina.
Okay.
How much, this is a question from Janelle, how much does self-care, like mind, body, spirit, play into leadership, recruitment, retention, and engagement?
I would love to say it's everything about what a leader should be doing. But the knowledge base of that and the acceptance of that as something to really focus in on is, I think it's relatively new among healthcare providers. And I think we've come a long way since the COVID surges that we've all had in the hospital setting, about the understanding and viewing that self-care for the healthcare provider as incredibly important. So I think right now where we are, this is a very personal opinion, unresearched, and it could be challenged, and I could be very wrong. But I think that's right now where we are. I think it's very leader specific and therefore organizational specific. I don't think we have a national consensus yet on how important that is. And I've only come to fairly recently, within the last probably year, really come to an appreciation of how important that is. And I am I'm putting that into practice, not so much for myself, but with the leadership team here. I say, hey, how are you doing? You seem not quite yourself lately. Do you need to take some time? We will cover you. And just make it, not that you look bad, not that you're doing a bad job, none of that stuff, but I'm just noticing you're not quite yourself. And I want to make sure you're taking care of you. That is honestly, I truly feel that right now that's a very individualized and a very deliberate approach for specific leaders that I believe needs to be a national focus.
Okay. Thank you so much for your time today, Regina, and sharing your insights and your thoughts and your strategies. We're really grateful. We're grateful to you. I want to show you gratitude. A member of our team will be in touch with the recording. And then if you have any questions, please feel free to reach out to us at questions@incrediblehealth.com. My colleague Danny also shared a link if you want to learn more about Incredible Health. And Regina, just thank you again so much for your time.
My pleasure. Thank you.
All right, thanks. Bye.